Smith right now from the CADASIL Together We Have Hope, so hopefully we'll get her on the phone. Is this Billy?
Yes, it is.
Hi, Billy. This is Gary Garver. How are you?
I'm doing okay, thank you.
I want to thank you for coming on the radio show, the Control Chaos radio show. It's a little chaotic in here. We'll get into that. But anyways, Billy, I want to talk about your, I guess it's your foundation. It's a nonprofit foundation called CADASIL Together We Have Hope. Can you tell us a little bit about it?
Well, my husband was first undiagnosed in 1996, and because no one knew what he had, I sent out records around the world, and Paris friends called me to ask me to tell me that they think it was CADASIL. And there was a skin biopsy at that time that could be done, so it took me 6 months to get that done, and he was diagnosed over the phone. And I got a phone call saying he had CADASIL. His dad died of 52. At that time, I started a website in 1997, 1998, and it was named CADASIL Together We Have Hope. You have to have hope, and together this disease is dreadful. And then in 2005, it turned to a nonprofit because the demand was so much. CADASIL is a cerebral autosomal dominant alterity with subcortical infarcts and leukoencephalopathy.
So what is that? Explain that. Now, my brother has just been diagnosed with CADASIL. He's been going through a battle for a couple of years, and it's been terrible. I mean, we couldn't find out what it was. They thought it was also multiple sclerosis. They have no idea what it was, dementia. And he took a genetic test at UCLA about 3 months ago, and they came up with this CADASIL, and nobody's ever even heard of it. I mean, when I tell people, because I have a lot of friends that ask about him, they're like, "What's he got?" And he's like, CADASIL. Like, nobody knows what it is. What really is it? What is CADASIL? Can you explain that to us?
Yes, I sure can. And you're right. No one knows what it is. If you go to a regular doctor's office and say you have CADASIL, they'll think you're crazy because they don't even know what it is. It affects the brain. When you think about your brain and your vessels opening, and I want to do a comparison to a garden hose. When there's a kink in the garden hose and the water's not flowing, that's when the blood vessels aren't flowing. The kink will either open up, but it causes damage to the brain. The symptoms are migraine-like headaches, strokes, dementia, small strokes, short-term memory loss, and many more. That's why there's no treatment or cure, because there's so much different symptoms. Plus, the NOTCH3 gene, there's over 150 mutations alone in the NOTCH3 gene.
And so it's a gene from what I understand, from what they told me and told my mom, is that it's a gene that one of our parents carry. Is that correct?
That's correct. People even can inherit cars, inherit $1 million from their parents, but there's a 50% chance of having this disease. So my husband and I have 2 children. My 30-year-old was just diagnosed with CADASIL.
Oh, you're kidding.
Now she has two kids, my grandkids. One's 11 and one's 7. Now when they have the 50% chance of having the disease. So until I die, I have a mission in life to help find a treatment or cure. The disease was named just 20 years ago. And presently, for research, they have got mice that have CADASIL. They've knocked the gene into the mice, and they're experimenting with drugs. And probably within the next 2 years, there might be a clinical trial happening with patients.
Oh, that would be awesome. I mean, my brother is going crazy. I mean, he's it's a terrible disease because it causes mass depression. His eyesight he's losing his eyesight. He was a personal trainer for 10 years, scratch golfer, and he can barely walk and see now. It's a mind blower. He's only 50 years old. I mean, we're really, I mean, words can't even describe what we're going through. It's just a terrible scene. I can't even believe it.
unless you have a family member who has the disease, no one understands. Honestly and truly, you can explain it to as many people as you can, but unless you see the symptoms and everything, and since there's no treatment, all you can do is treat the symptoms. But if you go to an ER room with a stroke and they follow the protocol for a regular stroke, it could cause a bleed and you could die.
Wow, really? So, I mean, it's such a new disease that these neurologists don't even know anything about it. It's crazy. I mean, is there any help here in the States? Is anybody doing any? I mean, I know you talked about France, but is there anybody out here in the States that are helping CADASIL patients out?
Boston, Massachusetts, Michigan, University of Michigan, University of Utah are the main three, should I say, hubs for CADASIL. They work closely together, plus also Vermont also works closely with Paris, France.
Oh, that's cool. Well, that's good. At least there's a few people. And you said there might be some help. There might be some sort of treatment or clinical treatment coming up in a couple of years.
Yes. And I really don't know how long, but we have a registry. The nonprofit started a registry even before it came to be a nonprofit. It was a guest book, and there's 1,400 confirmed cases on the guest book and registry. What we do is when there's a study, and there's been a study with the Aricept drug, that was in 2010, I think it was, 2005. I'm not quite sure the date, but what we do is, when they sign the registry and there's going to be a study out, we notify the patients to contact the study directly. So confidentiality for the nonprofit is very critical because of confidentiality.
Yeah.
Now, there's something here that people don't understand. It is important for you to know that there's nothing that you or your family did that caused you to inherit the CADASIL gene. We have no control over the genes we inherit, just as we have no control over the genes we pass on to our own children. That's a strong statement that has helped me when my daughter was diagnosed.
Yeah, I mean, you don't know. I mean, they don't even know. This thing just happened 20 years ago. I mean, this thing, CADASIL, just came out. I mean, people were, diagnosed with, like, multiple sclerosis, dementia, all sorts of different things that take on this disease. I mean, it takes on these characteristics, but it's not really what it is. And, I mean, like I said, we went through so many diagnostic tests. I mean, he was in intensive care for 4 days because they were draining his back to see if that would help. I mean, the spinal tap. It's just been crazy. I feel sorry for everybody that has it and has been maybe misdiagnosed with something else that has this. And I pray to God that the word gets out about CADASIL and
That's what the nonprofit is for awareness. We had created an app last year for iTunes and Google Play. We also have a mobile website, and patients use that when they end up in the ER room, when they go to the doctors to educate the doctors. We have brochures that they take with them to educate the doctors. We also have over 250 brochures just to the USA doctors to let them, for their waiting rooms, to inform them. So we are educating as much as possible the medical community.
So there is hope, though. There is hope. People are doing research, and there is hope for some sort of treatment and some sort of help. Man, I mean, he can't even get any medicine. There's no medicine. There's people are like, they ask me, it's like, are they treating him? I said, there's no treatment. There's no medicine. There's no help. It's almost like a hopeless case. It's really disturbing. And I feel so sorry for my brother. He's only 50. He just turned 50, and he's going through this, and he doesn't want to live the rest of his life like this. I mean,
no.
It's terrible. Listen, I want to thank you so much for calling in today. And if somebody wants to know a little bit more about this and your nonprofit organization, where can they go?
CADASILfoundation.org.
Okay, CADASILfoundation.org. That's CADASIL foundation.org. Well, I might even have it. There's a 50% chance I have it.
Right. And also they can go to iTunes or Google Play and search in CADASIL.
Well, I want to thank you so much, Billy.
Thank you for inviting me, and I'm sorry we had to talk and we did some circumstances.
That's all